mateeka g'eddagala eddagala tulimizisaaki mazzi ate nga mayonjo amafumbeko.
Over time, the government of Uganda has registered a commendable decline in the HIV prevalence rates in the country through use of various strategies. The latest, which government believes will further scale down the rate of HIV infections, is the Prevention of Mother-to-Child Transmission (PMTCT) strategy that's been rolled out in the entire country. The strategy involves enrolling HIV-positive pregnant mothers on a triple ARV treatment schedule regardless of their CD4 count, with the sole aim of enhancing the health of a pregnant mother while protecting her unborn baby from the HIV infection. So far, with this strategy alone, about 86% of HIV-positive mothers who receive ARVs are able to significantly reduce the risk of their children being born with HIV.
We have reduced the new infection of babies from infection of babies from their mothers from 28,000 to 8,000 or less. And this is within a period of about 1 to 2, 3 years. This is a very marvelous performance.
These positive results in the reduction of the country's HIV prevalence rates are partly attributed to the concerted efforts of a number of development partners, both at national and community levels. Community Health Alliance Uganda, in short, CHAO, is a not-for-profit non-government organization that implements various projects aimed at improving sexual and reproductive health and rights of young people through providing direct services in HIV counselling and testing. CHAO has contributed to Uganda's efforts to reduce new pediatric HIV infections through a 3-year ambitious project funded by PLHIV Healthcare and a Positive Action for Child Fund by increasing access to PMTCT, HIV/AIDS and antenatal care services through community-based interventions.
We are looking at increasing demand and utilization of PMTCT services, and we have seen we have reached over 1 million people mobilized at community level. The other aspect was to strengthen PLHIV networks to be in position to support PMTCT services.
The project was implemented in partnership with district local governments through community health facilities as well as community-based groups such as networks of people living with HIV to help bridge the gap between health facilities and the community they are mandated to serve. Mukono is one of the 4 districts where CHAO is implementing its activities in collaboration with Mukono and Koja Health Center 4s and HIV networks. CHAO is working in collaboration with 2 major networks, that is Asiko Bulamu within Mukono Municipality and Sichomu Development Group operating at Koja in Mukono South. This is a counselling session during one of the antenatal days at Mukono Health Center 4. Here members of the group counsel pregnant mothers and their spouses about the dangers of not testing for HIV as well as positive living. Music, dance and drama is one of the tools that Asiko Bulamu uses to reach out to community members with important information about HIV and AIDS through personal testimonies from the group members. During and after these drama sessions, it is always a common practice to see a number of people among their audiences going for voluntary HIV testing from health workers that move with the group. Those that are found positive are always enrolled into their network for counselling and treatment, while those who are found negative are encouraged to abstain, be faithful to their partners and correct use of condoms. On the other hand, Sichomu Development Group, another implementing partner of CHAO PLHIV project in the district, is one of the lucky beneficiaries of a community support centre that was built at Bugolombe, Mukono South in 2009. The group uses these office facilities to chart out plans for their next line of action in their bid to sensitize the community about the importance of HIV counselling and testing, as well as coordinating their income-generating activities.
Bwe tuba tukungaanyeeko awamu, ab'Ekkoome ne bajja, ab'e Ssetanazigo ne bajja, ab'e Nakisunga ne bajja, twaggwamu okusosolebwa kuli kwe twali tusosolebwa nga naffe twesosola. Naye kati tulina we tusobola okubeera ate tulina n'obusobozi okusobola okwekolera ku nsonga zaffe.
The referral system has also been improved thanks to the network support agents in the district, who move through the communities sensitizing mothers about the dangers of delivering using traditional birth attendants, especially when they're HIV positive.
We've tried very much to see that we also sensitize the fathers or the positive men to take action in the fight against the virus. In the PLHIV program, we had an activity where we are using the positive men to reach to other men. So those positive men, we are sensitizing the men in the community to escort their wives for antenatal clinics. And this has also helped them to know their status, because when you go with a husband to the health center, you are also tested.
With all the benefits the project has registered in the district, communities are now in position to mobilize and ensure the uptake of health services. Those who have been directly benefiting from the project wish it had more time for them. However, poverty coupled with long distances to health facilities, as well as poor male involvement in the PMTC program, are still major challenges in the district. A lot has to be done in these areas if the PMTCT program is to succeed and yield tangible results.
PMTCT.